Good day! In today's healthcare landscape, leadership means shaping systems that improve lives, not just managing organizations. Grab your cup of coffee and join us on Freshly Brewed, where compelling conversations unfold between inspiring guests and Business Mirror's journalist hosts. In this special Women's Month episode, we sit down with Dr. Diana Edralin, General Manager of Roche Philippines and President of the Pharmaceutical and Healthcare Association of the Philippines. She shares her journey from medicine to executive leadership, her role in advancing healthcare innovation and collaboration, and her advice to women who aspire to lead in science, business, and beyond. Joining her is our host, Anne Ruth Dela Cruz, Business Mirror's Health and Fitness Editor.
Hello everyone and welcome to Freshly Brewed. This is Anne Ruth Dela Cruz, Health and Fitness Editor of Business Mirror. Today's episode is especially meaningful as we celebrate Women's Month, a time to recognize the achievements of women who are making a difference in their fields. But before we proceed, don't forget to like and follow our Facebook page and subscribe to our YouTube channel. Joining us today is Dr. Diana Edralin, the General Manager of Roche Philippines and the current President of the Pharmaceutical and Healthcare Association of the Philippines, or PHAP. With a background in medicine and a career that spans both healthcare and industry leadership, Dr. Edralin brings a unique perspective on improving access to healthcare and strengthening the country's health systems. Dr. Diana, welcome to Freshly Brewed. It's wonderful to have you today with us.
Thank you, Ms. Ruth, for this great invitation and happy Women's Month to us.
Happy Women's Month to us.
And it's a fantastic opportunity to be here and also be interviewed by you, a fellow strong leader.
Thank you so much. Thank you, Dr. Diana. So let's start with your personal journey. You began your career in medicine and eventually moved into leadership in the pharmaceutical industry, right? So what inspired that transition and what motivated you to pursue this path?
Yeah, so I think that's a very great question because it continues to be something that fuels me in my leadership, and that has always been my passion for healthcare. Because if you will see, healthcare in the Philippines continues to be the main challenge, but also it continues to be the main opportunity in changing the lives of the Filipinos. And so when I was trained to become a medical doctor, I realized that even though you see 100 patients in a day, there's still a huge opportunity for us to make an impact. So when I transitioned to the pharmaceutical industry, I still had that purpose in mind to make an impact in the lives of the Filipinos, but maybe now this time at a larger scale.
Did you ever get a chance to practice?
Yes, I did. So as of today, I'm a specialist in occupational health and safety medicine. And I did practice for 2 years. So I worked in the clinics, I worked in the hospitals as well before I fully transitioned to the pharmaceutical industry.
Okay, so among the many experiences in your career, which ones do you feel prepared you the most for your current role as General Manager of Roche Philippines?
So I think all of these experiences have prepared me for this role. Being trained as a doctor gives you a sense of urgency that healthcare issues cannot take time. You need to act now, and you also gives you a better understanding of what exactly are the pain points in our healthcare system. Now, in the pharmaceutical industry, I first joined to be part of the medical affairs. So that's basically the task there is to deliver the science to the key stakeholders so that that science actually translates into access. So for the longest time, I think the highlight for me before I became the GM was also being a country medical director for various pharmaceutical companies. And before I became the GM, I was also head of the Asia Pacific when it comes to the life cycle molecules. So local perspective, but also regional perspective.
Wow, okay. That's so interesting, Doctora. So, and since you come from a clinical background, I'm curious about how that has influenced your leadership style and how has your training as a physician shaped the way you approach business decisions and organizational leadership?
Yeah, so I think two important things. Number one is the patient centricity. So like now at Roche, And also for the members of the PHAP, we are very patient-centered, which means that in achieving the business, we are able to achieve our goals because we know that the lives of the changes here in the Philippines and globally is actually changing, and for the better, that they live longer and healthier lives. The second about is, I think being a physician, a doctor, and also a woman has helped me to be focused on servant leadership. And I think it's quite different when you maybe in the corporate world, but I think the goal for me as a leader is to ensure that I create a cultivating environment for people to shine instead of the typical the leaders, you're the ones in the spotlight. But here it's really that, how can we have a more inclusive and a diverse culture so that everyone can really be at their best and achieve their maximum potential.
Okay. So aside from leading Roche Philippines, you also serve as president of the Pharmaceutical and Healthcare Association of the Philippines. So in that role, what are your key priorities for helping advancing healthcare here in the Philippines?
So there are three important priorities for PHAP. Number one is, faster and timely and sustained access to quality medicines on par with the global standards. That is a very important priority because today, with the advances of medicines, diseases like cancer, even rare conditions, need not to be a death sentence. So we want to ensure that we do a multi-sectoral partnership, so both the government and the private sector. As we did during the pandemic, we work together so that whatever medicines are accessible, in Europe, in the United States, in North America, and even our neighboring ASEAN nations or ASEAN countries, they also have access to those medicines. That's super important. Second is how do we evolve so that our regulatory systems can actually support that intention. Because one of the things that PHAP does is also bring in the learnings, the best practices, again, from ASEAN countries and, from Europe and also from the North America, so that we do have a resilient and responsive regulatory system. So that's core in what we would like to do so that these best practices, again, lead to sustainable healthcare. And the last one, I think it's super important for PHAP, having our PHAP Code of Ethics, is to ensure as we conduct business, we do follow the ethical practice and guidelines, not only here in the Philippines, but also across the world. Because I think for the longest time, the pharmaceutical industry has been aiming to be at par or to become a trusted partner of the government and the different, even patient groups, the communities. So I think the level of comfort and trust is actually guided by PHAP advocating the ethical practice of business.
Access to healthcare often requires strong partnerships across sectors, no? So what has been your experience advocating for closer collaboration between the public and private sectors, as you mentioned, when it came to access to medicines, right, Doctora?
So I think a very important example was, again, during the time of the pandemic, this multi-sectoral partnership wherein during that time, there were several requirements, for example, for vaccines, even the RT-PCR tests to be available here and the treatment. So we work closely with the Philippine FDA, with the Department of Health, and even with the embassies of the different countries so that there will be that faster collaboration and also so that we can overcome the barriers of the closed borders. So when you think about medicine, sometimes you think about just the approvals of the medicines here, reimbursements, but during the pandemic and even today, I think given the situation in the Middle East, the security of the supply, so that we can actually bypass the typical trade routes to ensure that all of the important life-saving medicines, innovative medicines, we will have to sustained access. And I think what's also important, especially during the pandemic, is the proper planning, because we need to ensure that for, again, the type of the drugs that our members produce are biologics. And it's not like you don't produce them overnight. Sometimes it takes about 6 months, like vaccines, to be manufactured. So proper planning is very important so there is sustained supply, especially for the life-saving medicines.
Okay, as you mentioned, the pandemic also changed many aspects of healthcare delivery around the world. How did COVID-19 reshape the pharmaceutical industry's approach to ensuring access to medicines and strengthening the health system's resilience?
Yeah, I think, what's very evident is this pragmatic approach. Sometimes, you're tied with the bureaucracy I think all of us would like to ensure that we have the safe, efficacious and high quality medicines. But then some of the processes, I think the pandemic has really given us an important wake up call that some of these processes, regulations have to be updated. Because again, healthcare is very dynamic, it's very responsive. So when, for example, right now, the challenges we have today, the number of drugs, let's say in the Philippine National Formulary remains to be the same like 6 years ago. We need to ensure that the ones that have now, like, for drugs diseases that don't have treatment before, the drugs are now available. So we have to ensure that it's made available for the Filipinos. So that's one important thing. We are closely working in this multi-sectoral partnership in ensuring that our, again, regulatory systems are dynamic, it's more responsive, and it's, again, learning from that. It doesn't have to take years. Like, predictable timelines are also very important. And I think we're learning as well, right, from the other countries wherein they're now at that level. So how can we bring Philippines along in that line? Let's say how Singapore does it, how Thailand does it, and how can we make that a reality in the Philippines? Second, I think that's also very important is the shared mission. When you have healthcare at the core, and we know that all of us can be patients at one point, we are caregivers. And it's important to have this interagency for the government, interagency collaboration. So, for example, when you're prioritizing tuberculosis, then all of us are working towards that, from FDA all the way to HTA, all the way to the Department of Health. And the implementation of the programs will be faster, so that when we address something and focus on that one thing, we are actually making an impact. So I think, in the COVID, we are very laser focused on addressing and fighting COVID. So we were very successful at doing that.
You also mentioned earlier about the problems we're having now in the Middle East.
Yes.
Would that affect our supplies of medicines?
Yeah, so that's also something that we are closely monitoring today. So right now, all of the members of the Pharmaceutical and Healthcare Association of the Philippines are, we have stable supply at the moment, but we are closely monitoring this, because any, deviations, or if it progresses, or if it changes, or it becomes, even, I would say, worse than the situation now, then we have to make the certain adjustments. But right now, I think it's as important to your question is, right now what we need is, like, PHAP has always been very proactive. So we need, again, this close partnership with the government. Again, as I mentioned earlier, the planning of how much supply do we need. So if we need vaccines, let's say flu vaccines, so how much of those flu vaccines are needed today? If we are, ensuring the security of life-saving medicines for cancer drugs, how do we ensure that we have enough supply, let's say, to last us for the entire year?
Okay. So, keeping up with our Women's Month theme, you are the first woman to serve as president and of PHAP. And is this your second or third term?
It's already my 5th term.
Oh, it's your 5th term.
Yeah,
wow.
yeah.
So how has this experience shaped your perspective on leadership, representation, and the importance of diversity in the healthcare sector?
Yeah, so it's always a humbling opportunity to be given this opportunity. For PHAP, you have to be elected by your peers, the Board of Trustees, or also general managers of, great companies, members of PHAP. So every year you have to be re-elected. So on my 5th year, that's why I say it's a humbling experience, because, again, going back to the servant leadership, as a woman, I have really truly created, that nurturing culture even across the leaders within the Pharmaceutical and Healthcare Association of the Philippines of, number one, ensuring that all voices are heard. Second, what's also important is that how do you ensure that you create that inclusive environment, depending on, because each company would have their own needs, or each leader would have their own personalities. How do you have, situational leadership as well? How do you adjust to different situations? But the third one, I think it's what's super important is, again, this open and honest communication. The vulnerability of a leader, and I think as women, it makes us natural to be vulnerable, but equally important, that remains to be our strength. And I think that has, really resonated well with my peers and the Board of Trustees and the members of the Pharmaceutical and Healthcare Association of the Philippines.
Okay. So for many women watching or listening today who aspire to leadership roles in science, medicine, or corporate environments, what advice would you give them as they navigate their careers?
Yeah, I think the first and foremost is women as parents and as carers. Please continue to support young and aspiring women to dream whoever they want to be when they grow up. Let's not box women at a very young age. You should be like this, because I think the opportunity in having more women in science today is it seems that we think more of the barriers rather than the opportunities. But I've always believed, being the eldest among four sisters, and a very, I would say we have a very matriarchal family. All of my lolas are actually were the ones who brought up the family, and my mom as well. So we need to have role models in you so that women can continue dreaming that they can be whoever they want to be. Okay. For the leaders listening, to this program, what's also again important is that we continue to make the necessary platforms and opportunities. Think about the potential, not like the barriers again. Because when you give opportunities, as a leader myself, as you mentioned, most of my background is in medical.
Yes.
But there were people who believed in me that even though I have not had like an MBA during the time I became, doing the more leadership roles or commercial roles, that they believed in my potential and in my leadership. And then the third one is, of course, this the allyship. Not only to the women listening, but also equally important to the men and, of all different genders, is to really champion. Again, for the women, usually we hesitate, right?
Yeah.
So we need that allyship, which is very important. That at the point when you're hesitating, you need more supporters to encourage you to continue.
Okay. So since we are celebrating Women's Month, I'd love to hear your thoughts on its significance.
So this year, the theme of International Women's Month is Give to Gain. And I think for us to be able to continuously achieve diversity, inclusion, and empowerment, we need to give more. And I think that pertains to what I mentioned earlier. In situations where we feel that someone is requiring additional support and help to us. And giving, for me, the role right now, I'm giving more to society. I'm giving more to nation building. Then I am helping more women to be able to, again, to make that impact to the society. And also to our families, because I think that's very important. The basic unit of any society is the family. So before we think about, changing the world or world peace, I think we also need to think about what kind of impact am I making on a daily basis at home and to my loved ones and to my friends.
Okay, so looking at the broader landscape, how can organizations better support and empower women in leadership positions and in STEM fields?
Yeah, so I think the first important is give them the opportunity. Right. So sometimes we want like all the tick boxes to be present, but no. And I think for both for women and the men, what's super important is, again, you look at what does the role entail, but how do you also envision it to be evolving? As leaders, we need to take those risks.
Okay.
And also at the same time, as you take the risk, provide the adequate support. Because no leader, whether men or women, will be able to be ready on day one. But how do you ensure that in those opportunities, in their roles today, that they are given opportunities, not only within what you think their scope is, how are you also nudging them? Transferring from like a more medical role in nature to a more leadership role in nature has given me a lot of enlightenment in terms of having that self-awareness of the things that I can do and what are the things that I'm less comfortable in doing, but I continue to push the barrier. So the leaders should also encourage, again, in their different organizations, to continue pushing those boundaries.
Okay.
Because I think in the fast evolving, in an AI-driven and digitally driven environment, the more we take risks and the more also we create an environment, also for failure. Because the level of comfort of the leaders in an environment wherein you always want to win, but how can you also derive from the learnings?
Yeah,
so I think in that, whether it's, again, females or males, you need to have that environment that also tells your people, your team, I got your back.
Okay. Yeah. So, and thinking about the future, what kind of legacy would you like to leave for the next generation of women in healthcare and in business?
Yeah, for me, what's very important, being a severe COVID-19 survivor, being a patient myself, I never thought that I would live another day, to be here, to be in this interview, or to be celebrating another Women's Month. So the legacy that I would like to leave to not just for women but for the entire Filipinos is that the quality and accessible healthcare, so that when another pandemic comes, if I get hit by breast cancer or I have any other of my family members, that they wouldn't choose to die so that their family can live. Accessible healthcare is something that will really benefit the generations to come. And here at Roche and the Pharmaceutical and Healthcare Association of the Philippines, we are also advocating for that, not just only in the leadership today, but also for the generations to come. So that, again, we get that seat at the table, and we are now in close partnership with all the stakeholders that we're working with today.
Okay. So since you mentioned the future of healthcare, from your perspective, what major opportunities or challenges do you see for the pharmaceutical industry over the next decade?
Well, I think number one, as mentioned earlier, how do we ensure that our regulatory systems are very responsive? And how do we learn, again, from the lessons in the pandemic and even the lessons today, with the geopolitical issues? How do we ensure that we are able to anticipate? Because right now, I think we are more reactive rather than strategic about healthcare. We need to make that change today. And how do we also adjust? So it's not a challenge, but I think it's an opportunity, AI and digitalization. A lot of the things that we're doing in the Philippines today are still manual. So how do we ensure that we are leveraging on the technology? We are, Philippines, I believe, is where we're one of the technologically advanced nations in Southeast Asia. So how do we leverage on that skills? And how do we also ensure that, again, the next generation has better appreciation of the value of healthcare? And I think finally, again, looking at the different opportunities today, how do we leverage, again, on the regulatory systems, for example, right now, the ASEAN Summit is happening here in the country. There are best practices that are happening in our neighboring countries. So how do we leverage that? That's an opportunity for me, because you will see regulations in Europe. They have the European Medicines Agency. So I'm also, the opportunity and the challenge for us is how can we make an ASEAN harmonization moving forward, so that healthcare, again, is more responsive, and that, the long regulatory processes, whether reimbursements or HTA reviews, are actually faster, because now we are relying on each other's strengths within the ASEAN nations.
Okay. So for the young professionals entering the field today, whether in healthcare, science, or business, what can they do to build resilience and adaptability in an increasingly complex world?
Wow, that's a very important question and important mission. I think number one is, I go back again. All of us have had a person that we know that had a major important disease, whether their experience during the pandemic, whether today when you are caring for your parents, where you're caring for your loved ones. Think about what they are going through or what you are going through. So I think that is the very first step for you to be responsive and resilient, because you go through the pain points. So now when you are in the government or where you are in the private sector, you make timely decisions, evidence-based decisions to make things happen. Because we have great laws, we have great regulations, but we need to focus on, especially today, in the time today, is more excellence in execution. And most importantly, how do we constantly communicate so that we can pivot and change wherever it's not working? Because I think that's super important. And of course, it will be guided by AI and technology to make those evidence-based decision making.
Okay. So before we wrap up, I'd like to ask one final question. If there's one message you would want our audience to remember from our conversation today, what would it be? So
I think what's important for our audience to remember today is the importance of believing in yourself. As a woman, there were lots of times that I doubted myself. And I think with the experiences that I've been given, with my faith, my values, and the most important thing is the people who believed in me. So believing in yourself, but when you now have the opportunity, again, giving to gain, give that opportunity to others, believe in others, express gratitude, express the support, because you never know when that encouragement will work its magic.
Okay. So, Dr. Diana, thank you so much for sharing your insights and experiences with us today.
No, thank you so much, Ms. Ruth, and thank you to Business Mirror.
Thank you. Your journey is a powerful reminder that leadership in healthcare is not only about innovation and science, but also about compassion, collaboration, and purpose. And to our viewers and listeners, thank you for joining us for this episode of Freshly Brewed. This has been Anne Ruth Dela Cruz, Business Mirror's Health and Fitness Editor. Until next time, let's continue celebrating the leaders and ideas that help build a healthier and more inclusive future.
And that wraps up today's episode of Freshly Brewed. Thank you for joining us as we explore Dr. Diana Edralin's leadership journey and her commitment to strengthening healthcare in the Philippines. As we celebrate Women's Month, may her story inspire more women to lead with purpose and confidence. For more stories and insights, visit businessmirror.com.ph. Stay ahead, no more, and see you next time.